welcome to the latest episode of What Your GP Doesn't Tell You, the podcast for both doctors and patients with me, Liz Tucker. Many apologies for the delay in this latest episode. I almost entirely lost my voice, which is not ideal, clearly, for a podcast host. In this week's podcast, I'm talking to Norwegian GP, Dr. Torkil Færø, who argues wearable devices that measure our heart rate and other health metrics, if used in the right way, can be transformative for keeping us healthy and helping prevent disease in the future. In his book, The Pulse Cure, published by Quercus, he explains why he thinks far more attention should be paid to a key metric measured by these devices. It's a metric which turns out to give a surprisingly accurate snapshot of our level of stress and overall health. And it's something called heart rate variability, or HRV for short. In our conversation, Torkil explains what it is and what we can do to optimize it. Remarkably, it turns out that drops in our HRV may predict future illness, and a higher heart rate variability has even been correlated with a better performing immune system. But before we get to Torkil's interview, a brief request from me. If you enjoy this podcast and would like to leave a review on Spotify or Apple, that would be much appreciated. It really helps. You can also become a paid supporter of the podcast at patreon.com/whatyourgpdoesn'ttellyu or via PayPal on my website, whatyourgpdoesn'ttellyu.com. A huge amount of work goes into both the research and production of this podcast, so even a small amount of money makes a huge difference. And you can find out more information about the pod on my website, where you can sign up for the podcast mailing list, follow me on Twitter at Liz C. Tucker, and on my Substack account, liz.tucker.substack.com. Many thanks. And now back to the interview with Torkil. Dr. Torkil Færø is a GP, an emergency physician. In 1996, he was one of the first Norwegian medics to work for Doctors Without Borders when he worked in Angola during the war there. In his 25-year career as a doctor, he's worked all over Norway and says in his experience that the causes of many diseases are often found in the stresses our lifestyles put on our bodies. Here's Torkil's interview. So Torkil, thank you so much for joining the podcast today.
Thank you for having me on. It's a great podcast. I love listening to several of your episodes, so it's nice to be here.
Well, thanks so much. And Torkil, one of the things that sparked your research was deciding in your 40s that you needed to get into shape. And it always surprises me when I talk to doctors that preventative medicine isn't something that they seem to think about until relatively late in life. Why do you think that is?
We weren't taught that in medical school. I think my impression from medical school was that if I did everything right, I may live like 3-4 years longer. But that would take me 3 or 4 years to do that, to achieve that. So why bother? You would have to exercise half an hour every day. You would have to sleep 1 hour more every day. Just that would take you 4 years. So I just thought, I can sleep when I'm dead. Of course, now we know that it's not only 3 or 4 years. And a big American study shows that if we do the right things, which is basically the advice that I'm telling about in The Pulse Cure, my book, we can gain 24 years more. And that is also my clinical experience. If I meet a patient that is vital even in their 90s, they have done most of these things right. And when I meet people who are chronically sick in their 60s and early 70s, they have done a lot of these things wrong. So it matches my clinical experience. So I think that was the reason, and we didn't know the effect of good sleep, good nutrition, exercise, the rest, sunshine, sun exposure, and all of these healthy things. We just didn't know the effect of it.
All the emphasis was on treating illness rather than stopping yourself getting ill to begin with.
On treating illness. We studied medicine. We didn't study health. We were good at categorizing different diseases and finding out which medicine or procedure or surgical procedure is right for you. That is what we were taught. And the physiological background for these diseases. So what kept you healthy was hardly on the curriculum. Disease is a matter of luck or genetics. And don't smoke. Don't get overweight.
And I suppose it's true to a degree, isn't it? Because all we can do is stack the odds in our favour as much as possible.
Yeah.
But we could still be unlucky and get, some awful cancer or neurological illness.
Absolutely, but we now see more and more that cancer is a metabolic disease and not so much a genetic disease. The diseases that we treat, 80% of them are based on chronic low-grade inflammation. Also cancer, also heart disease, dementia, and Parkinson, and autoimmune diseases, almost everything. So I think we can do really a lot. And in this American research that I'm talking about, it's 24 years. If you do the right things compared to if you do those things wrong. Probably if you're in the middle there, 12 years to lose and 12 years to gain if you have just an ordinary lifestyle.
Because, of course, people will always point to the person of 85 who smoked all of their life and drunk half a bottle of scotch a day. So there will always be outliers.
Yeah. They may have been very social. They may have had good relationships. They may have been sleeping well. May have been good at de-stressing. You don't need to pull all the levers, You can do 7 out of 10 things right, and you will be forgiven for smoking. Maybe that person would have lived until 90. So overall, you want to do your part of the job. Bad fortune you cannot predict or do anything about, but doing your part of the job is to live as long as possible. And the good thing is that whatever gets you more well-being in the moment and more health in the moment is exactly the same strategies that helps you live longer. It takes some effort every day. You don't get away from the effort. You either do some effort every day within your control, or you can wait until you get sick with a lot of effort and outside of your control, in the hands of the doctors.
And is it ever too late?
That is what is great about this American study, because it showed that if you have these 8 good strategies when you are 40, and then I'm talking about good nutrition, good sleep, good stress management, not smoking, not using opioids, having good relationships, exercising. Yeah, I don't remember all of them at the moment. So if you do them from you are 40 years old, that is when you get 24 years extra. But if you start when you're 60, and that is the good part, then you get 18 years extra. And that is basically doubling the rest of your lifetime. And I can see that on many patients also, that they may have had a poor lifestyle, they may have been smoking, not exercising, but if they start that, even from the age of 60, then they will get healthier and live longer.
Now, the key metric that you argue is really important for our health and yet gets very little attention is heart rate variability. Can you explain what that is?
Yes, heart rate variability is a metric that can show the state of your autonomic nervous system, but it will also show the overall state of your body. And it's not so strange. The ancient doctors from Greece and China or India, they knew that they could read a lot from your heart rate, from your pulse. And the heart rate can tell us so much about the state of our body. Now that we have these wearables that can detect the heart rate variability and also use artificial intelligence and data from millions of users, we have a measurement that can help us to live in this good lifestyle. Because what is nice is that everything that is healthy will be shown in the heart rate variability.
But what's it actually measuring? What's the heart rate variability actually measuring to come up with the numbers that we see?
The heart rate variability is the variation between heartbeats. And if we are in the relaxed state, the parasympathetic state, we have the autonomic nervous system with the sympathetic, activating, mobilizing state, the survival state, the fight, flight, and freeze, and fun, I would also add. And then we have the relaxed state, the parasympathetic mode. That is where most of the recovery happens. When we are in that relaxed state, then the heart rate will have a variation between the heartbeats. When we breathe in and the lungs fill with oxygen, the heart rate will go up a little bit. And when we breathe out and there's less oxygen in the lungs, the heart rate will slow down and save some energy as there is less oxygen and not so efficient. But if we are in the stress state, then the heart rate will beat like a metronome, like a clock. And of course, it's a sliding scale from deep rest and until full power. And the watches and rings and so on will detect these differences and keep track of your stress level day and night while you're busy living your life, because we cannot really feel this. A lot of people would say, why do we need to listen to our heart rate? We're not developed to be able to feel this because all our senses are directed outwards. We have excellent eyesight, we have excellent hearing and taste and smell because historically throughout evolution, all the threats came from the outside. But now in our days, the threat comes from our own lifestyle, our own stress levels, or rather our own inability to recover, to be in the restful mode. And we cannot feel that. I would be challenged to know whether I have a 60 or 80 in the heart rate. It's really hard to tell. So that kind of tells you how poor we are at listening to ourselves. And of course, if we had been good at listening to ourselves, we wouldn't be in this mess with all these diseases that stems from stress, all the burnout situations. We would have been able to avoid that. These wearables is kind of a substitute for this sense that we never needed to develop. And we can see on our monitors, just like a dashboard in your car, you can see your physiological speed and intensity based on your heart rate. And of course, when you see that, what can be measured can be managed. So then it's so much easier to see that. When you have this instrument that can help you find your stress balance, you will feel better in the moment. And luckily, over time, you will improve your chances of having a longer, healthier life.
So basically, a low level of heart rate variability suggests your body's not coping with chronic stress very well.
It shows that your body is under stress. Your body is struggling. It is working hard just to stay alive. And the stress may come from many different sources. It's not only the traditional, and that is the surprise when you start managing your stress levels, that your stress levels is not necessarily the mental stress that if you ask people on the street, they would say, okay, is it stressful at your work, a stressful family life? Do you have a disease? Is it just not enough hours in a day that you can accomplish what you have to do? It will show in your heart rate if you are stressed in that way. But most of the stress comes from surprising sources. It comes from alcohol, which you would think maybe de-stressed you. It can come from nicotine, from vaping or whatever nicotine use. It comes from a poor diet. It comes from ultra-processed food. It comes from too much or too little exercise. It comes from certain food intolerances. So it can come from so many surprising sources that you will reveal these energy thieves because you will see it in your heart rate, that your heart will respond to this strain on your system. And if you have a continually low heart rate variability, that will mean that your immune system is not working properly. You are inflamed. The immunologist Jenna Makiyoki, who has written some excellent books on the immune system, she writes in her book that heart rate variability is a measurement of the state of your immune system.
And I'm interested because I think there's confusion here because people hear about heart arrhythmias and they know that's a bad thing. And that sometimes gets confused with heart rate variability.
If you have an atrial fibrillation or such, then there will be a big variation between heartbeats, of course. But it's an unhealthy arrhythmia. When we have this, what we call sinus arrhythmias, heart rate variability, if you listen to a child's heart, it would be particularly huge variation between these heartbeats. You could really, really listen much more detectably in a child. The older we get, the less heart rate variability we will have. And the heart rate variability can differ even at the same heart rate. So I can see a lot of athletes that would have the same resting heart rate at night, but could have a huge difference in heart rate variability, so that they could see if they are overtraining or overreaching. They would be able to see that in their heart rate variability, but not necessarily in the heart rate. It could differ maybe by 1 or 2 drugs, while the heart rate variability could differ by 40 or 50%.
So just to be clear then, if you were listening to a patient's heart through a stethoscope, if they've got arrhythmia, what do you hear as opposed to the heart rate variability?
If you have a heart rate variability difference, it would be like waves on the ocean. You would feel it speeding up and then speeding down again, speeding up, speeding down again at a very regular pace. But if you have an arrhythmia, there will be no system in it. The strokes could happen at any time. It could be like 3 fast strokes and then 1 long one. It's irregular arrhythmia versus regular arrhythmia, I would say. That would be the difference.
Which sounds like a contradiction in terms, but I get what you're saying. I've never been into any doctor's surgery where the HRV has been mentioned. Why isn't it measured if it's so key?
I'm not sure. I hadn't heard of it until 5-6 years ago. And I was reading in the book The Body Keeps the Score by Bessel van der Kolk, the huge bestseller. He was writing about how they, in psychiatry, were using heart rate variability as a measurement of the autonomic nervous system, and how they could see that if the patients got better, they would see it in the heart rate variability. They would also see that if the heart rate variability was really low, this patient was not now available for therapy. They would have to wait until the heart rate variability got better. And I think part of the why they don't know is that the autonomic nervous system has not been focused on in the medical school. So that may be part of the reason. We have been over-focusing on our intellectual prefrontal cortex, and we have underestimated the power of the autonomic nervous system. I call it the living inner fossil in our brain, because this part of our nervous system is 100 million years old. It still works pretty much in the same way. So we have built our prefrontal cortex on top of this fundament of our brain. And this part of the brain is what is disturbing us to a large degree. So if you are too stressed, it's hard to think clear. So if there's too much strain on this system, this is when we get sick, we get brain fog, we get burnout, we get problems concentrating because of too much stress. And then, as I said, often from unsuspecting places that you wouldn't necessarily think that it's your 2 drinks of alcohol that is causing you this stressful situation. You wouldn't necessarily think that. I didn't think that. I was drinking 2 glasses of wine every day. That was doctor's orders till probably 10 years ago.
Not exactly doctor's orders, but you could drink up to that level.
Yeah, you were actually encouraged because the people that were drinking 2 glasses of wine lived longer. But what confused us, the confounding factor, was probably that they were more social.
Sure.
And now we know so much more about loneliness. Now we know that there's no amount of alcohol can be consumed for health reason in itself. But it could be a sign, a biometric, that this person is social, have good relationships, and maybe more active in that sense.
So even 1 glass of alcohol, depressingly, has an effect bringing your HRV down.
Yeah, and according to Whoop, one of the bracelets that tracks heart rate variability that many footballers use, many athletes use, they say that alcohol is the worst stressor of all. I thought it was helping me wind down in the evening, and it does, but the problem comes at night when the alcohol is transformed into acetaldehyde, which is so poisonous, your body has to get rid of it, and it's toxic. When you use heart rate monitors, you can see that the reason why you wake up and feel sluggish in the morning is not just a feeling, it's because your body has been through a hard marathon at night.
But does it make a difference to the type of alcohol you're drinking? Because certainly for me, if I drink red wine, I know I'm more likely to respond badly. But if I drink white wine, rosé, or beer, I'm much more likely to have an undisturbed sleep.
Yeah. So that's typical that the more colored drinks tend to be more stressful on the system. It's also a very individual, so that it depends on who you are. Some people would not be so disturbed by it. Typically, if a couple comes and they can say that my husband will barely notice 3 beers, but this person cannot tolerate even 1 glass of wine. So this is a kind of personalized medicine that will show how you respond to a certain factor, and not as we are traditionally trained in medicine to see out of a research study, what is the average of those 10,000 people being exposed to this? This average may not mean anything to you because you may be on the completely other side of the spectrum.
And is there anything that we can do to mitigate this? If I have a glass of beer when I get out with friends and I come back home, is there anything I can do to reduce the risk?
I think the best thing is to have the drink as far away from sleep as you can. So the later, the worse, because it will be stressful and disturbing your sleep. I think that a cold shower would help.
Oh, God. So I come back from night out in the winter and I have a cold shower.
But if it's just one beer, it doesn't matter so much. For most people, for some people, it really matters. For me, it really matters. I cannot function properly even with one glass of wine or one beer.
Were you aware of it disturbing your sleep before you started measuring these metrics carefully?
I was not aware. I thought that it would help me sleep.
Yeah.
I was falling asleep. I was sleeping all night long.
So there was no obvious indication. So I might be in your situation. I'm aware that red wine might wake me up, but I think, perhaps erroneously, that if I have a beer, I'm fine because I sleep through the night. But actually, if I start to assess these metrics in more detail, I may find that that's not the case, that actually it is having a negative effect on my body.
Yeah. Yeah. Of course, when you see patients, the ones that look the worst, that is the alcoholics. And when do you as a person look the worst? After being out, with 3 or 4 drinks, you look in the mirror and you can clearly see that you're not looking the same way that you did the day before.
But there's a difference between me having 3 and 4 drinks and just having, say, 1 beer with supper.
Yeah, probably with supper is better if it's early, than at 10 o'clock. And the good thing is that you can measure it, you can control it. When I'm talking about micromanaging your stress level in the way that I'm talking about in the book, I'm talking about the Garmin watches, because none of the other watches, and I'm currently having 4 devices on my hands,
I can see them.
I have not been able to micromanage so that you can see clearly that this beer had this effect from 7 o'clock until 9 o'clock, for example. You would not be able to see that with the other wearables. But here you could. So you could see that, okay, 1 glass of beer at 6 p.m. is totally different from the same glass of beer at 10 p.m. regarding your sleep. So you can use this as a mean to investigate and have the conversation with your own body on what happens when you have this kind of speedometer for your autonomic system.
Okay, well, let's look at the wearable devices in a bit more detail, because that's obviously key to this. It's really the Garmin watches that you think measure all the factors that we need to look at, and the others elements, but not everything.
Yeah, it's not Garmin in itself, but it's because they have bought the Finnish company Firstbeat Analytics, which have been doing physiological measurements for more than 20 years. So they have taken their algorithms and probably also improved on them, and that is the secret.
And what seems to be key with the Garmin watches is this function called body battery.
Yeah.
Can you explain why that's a useful thing to assess and measure?
Yeah, so the body battery system in Garmin or from Firstbeat will tell you how much have you been recovering throughout the night. Based on heart rate variability, based on sleep quality, it goes from 0 to 100. And most days you would need to have a body battery of 80 is what I find. 80 in the morning, and then try not to go under 20 in the evening. That is when me and many other people function optimally. I can see a lot of people, if they struggle to get over 40, for example, in the body battery, it's accompanied by health problems, autoimmune diseases or fatigue situations, fibromyalgia, joint pains, and many other things. This is a way that you can see that you are well enough rested in the morning, and then you can make a decision. Should you exercise? Should you put on some more strain or not? You can make some decisions for the coming day to make sure that you are landing within the 20 body battery in the evening on most days. Because of course, we're not supposed to live a rigid life. We're supposed to have a pulsating life, a flexible life. But if you manage to have the control yourself and make most of your days within that range, that is what I see is healthy.
And it can be as bad, I would imagine, to have too much exercise as too little.
Yes, a lot of people exercise too hard. A lot of people want to do everything right. And when they're exercising, they're going all out. They put on too much strain on themselves. That is also what is good with the Garmin watches, that they will give you a recovery time after the exercise. that will tell you how much strain was this. And particularly if you have a lot of lactic acid, that will give more recovery time. And this is why the athletes, they are testing lactic acid with blood test to make sure that they are not running so fast that they get too much lactic acid, because then they need a lot more recovery time compared to how useful that is to be above that level. The Garmin watches will give you a heart rate. My heart rate for the threshold for lactic acid is 163. So I just then need to stay below that level when I'm exercising. So many people exercise too much compared to the stress in their life. So if they are, for example, drinking alcohol, they would have less available energy, so to speak, to be able to tolerate a high quality or high intensity workout.
I occasionally get migraines, and I know if I just have one stressful factor, they probably won't happen. So if I drink alcohol, I'll probably fine. But if I drink alcohol, I'm tired, stressed, and I eat some chocolate, then that's probably a perfect storm. But one or two of those I will get away with. So I've learned to manage it pretty effectively.
Exactly, yeah. On the watch, you would see that if you woke up tired, then you would start with more stress. And then if you take a chocolate, you would see that this is also stress. And that is, of course, a huge surprise to me, that chocolate or other kind of sweets or candy will give me stress. Who would have thought that your heart rate can go up like 10 beats from the chocolate? And that is, of course, motivating. So when you see that the chocolate or bag of crisps or anything will give you stress way into the night, it's, of course, not as tempting to have that bag of crisps in the evening.
So what's the mechanism of that the carbohydrates will be largely converting to sugar in your bloodstream? And how is that affecting your stress levels?
I'm not exactly sure why, but it's clearly that it does, which will also be different from different people. Some people will be troubled by it, other people not so much. But you will see how it will affect you. For me, for example, pizza is terrible, so I'm not eating pizza anymore. If I eat a pizza, I will know that when I wake up in the morning, I will be tired.
What about if you make your own pizza?
Even then. I'm not sure why, but it's quite obvious. And when I ask on Instagram, I may show a curve, for example, from some food I don't tolerate. I can ask, what is it that you find out that you don't tolerate? A lot of people will mention pizza there.
That's interesting. I try to limit my processed carbs. I don't have a ketogenic diet, but I try to keep my carbs to under 100 grams a day.
Yeah, and I think the key also is not necessarily only the fast carbs, but the ultra-processed part of it.
Yeah.
That they have mixed in things that our immune system is not really made to recognize or understand what to do, and it will lead to inflammation in the gut. I think that is the main reason why the heart rate can go up so much in ultra-processed food. And that may also distinguish which kinds of ultra-processed food is good or bad for you.
Now, you mentioned Garmin watches. If someone's thinking, yeah, I'd really like to start doing this and assessing my HRV and my body battery metrics, there's a huge range of these watches. Some are pretty expensive. What's a good sort of starting point for people?
The main point is to have HRV over time. And the really cheapest ones may not have that. But I think from probably 200 pounds, I would think, or 30 euro, you would get one of these watches who will have HRV over time. And that is good enough. Of course, there's a price range upwards, that probably 4 times that amount. That will be better at exercise training. I usually recommend if people have real health problems, they should get the upper range because it would be worth it. But if you're a regular person, you just want to adjust your lifestyle just a little bit and you don't have so much money, then these 200 pounds watches are really enough.
And so for the people who've got serious health problems, why would those more expensive watches help?
Because they will give you more data. They will give you more data on exercise. They will give you a training readiness. And if you're in, for example, a fatigue situation, then you may not tolerate maybe just a walk in the park. You need to know your training readiness to do the walk in the park. Because I can see that many of the things that we as doctors struggle to diagnose at the office, because if you have a fatigue situation, long COVID, for example, we have no metrics that will react to that. We cannot see, but you will see it in the stress levels. So I can clearly see that a person with long COVID will have different stress levels from other people. They may have stress throughout the day. Just a warm shower, they should rather have a cold shower then. Just a warm shower or a walk in the park can set them back more than my run today for 45 minutes.
If you got, I don't know, a cheaper Garmin watch which had the HRV and the body battery, it would show your body battery depleting, presumably.
Yeah.
But it wouldn't give you the micro detail.
Yeah. But it will have the VO2 max, it will have the body battery system, and it will show you the stress in the moment. And that, I think, is the most important thing about the Garmin watches, that you can push a button and you can see the stress level in the moment. So if you're sitting in a meeting, you can see, wow, oh, my stress level is high. Let me do some breath work or calm myself down.
Well, I was in a really stressful meeting once and I was wearing a glucose monitor and I just saw my glucose level just shoot up.
Yeah.
And I thought, well, hang on a moment, I'm not eating anything. What's going on? And then I realized, and I knew it was a difficult meeting. So I knew I was stressed in the moment, but really interesting direct biological evidence of seeing that.
Yeah, so I also encourage people to use the CGM for at least a month and maybe do 2 weeks of just living exactly as they do, and then 2 weeks to try to improve it and see the difference, because there's really so much you can do with your blood sugar. And this is, of course, a way to use modern technology to help us live healthier. I think this revolution has just barely started. There's so much we can tell from our blood sugar levels, from our stress levels, with the heart rate, that can help us to guide us along to a healthier life. What's interesting also with the technology, it will show you that what you need to do is to live more like our ancestors. The wearables will tell you that it's a Stone Age lifestyle that will keep you healthier. Getting enough movement, getting enough sun exposure, sleeping enough, resting, enough during the day, eating food that our system is made to digest, being exposed to cold and temperatures. So most of our current lifestyle, living indoors, being transported around, messing with circadian rhythm, eating foods that we're not supposed to. If we fight our biology, we lose. So we have to play with our biology and not against it. And our heart then will warn you that what you're doing is not what is healthy for you.
But I assume a good heart rate variability will also depend on your sex and age and perhaps your genetics too.
Yes, absolutely. I hear different numbers, but up to a 50% genetic difference in your baseline of your heart rate variability, which is why you shouldn't compare your heart rate variability to someone else's. You should just see what is your optimal heart rate variability and compare it to yourself.
So how long does it take to make improvements or changes? Let's say I think my HRV is too low and I start to make changes. How long would it take for me to see those metrics alter?
That would depend on what you would be doing wrong. So if you, like me, had 2 glasses of wine every day, there will be a huge leap the week after, in days afterwards. You may double it, go from 25 to 50 in heart rate variability.
So if I was eating McDonald's 3 times a day and I stopped, but if I'm already eating a relatively healthy diet?
So it depends which level you go from. Most people would be able to see significant change by starting to sleep better, eating better, exercising more, but that would take some time. You will be able to measure your VO2 max from your Garmin and several of the other devices as well. And your VO2 max level is really important. So the health level and longevity is very tightly coupled to your fitness level.
And for anyone that doesn't know, can you explain what the VO2 is?
The VO2 max is a number for how efficient your body is metabolizing oxygen. And it would affect not only your ability to run fast, but it will affect your overall physiology. You have better mitochondria. And we know now having healthy mitochondria is the key to having a good health.
And mitochondria are the biological sort of batteries in our cells.
Yeah, the biological batteries, and also doing a lot of more things. Traditionally understood it as the powerhouse of the cell, but we now know that they have so much more functions in the regulation of our whole physiology. So we want to have good mitochondria working well. Also sun exposure and light exposure, red light therapy and so on, is a key to having good mitochondria. And mitochondrial dysfunction is also coupled to heart rate variability. And there's so much research. So you can Google almost any kind of condition and you add heart rate variability and you will see lots of research, because this is an easy biometric to get. So if you're doing a huge study, it's easy to just add heart rate variability as one of the metrics. So it's lots of research on cancer, on the risk of getting cancer. Once you get cancer, it will tell you something about the prognosis. If you get rid of it in the first place, it will tell you something about the recurrence of getting a relapse. So a low heart rate variability is a sign that your body and immune system is under pressure and not functioning optimally.
Now, you mentioned sunlight. For those of us who live in Northern Europe, like you and I do, this time of year, the sun's pretty weak. And in fact, I remember doing a podcast about vitamin D some time ago. And this time of year, we're not really getting any vitamin D from the sun. So is there still a value in sunlight even in winter?
Yes, because one of the good things about the sun exposure is vitamin D. But that's just one of them. There's so much more to sunlight. It's improving our mitochondria. We'll release more melatonin in the mitochondria that will make them more efficient. So even if there's less vitamin D to get out of the sun this time of year, it still benefits from getting sunlight. So I'm not sure how we ended up thinking that sunlight was bad for us. The huge biobank study that shows that if you get more sunshine, more sun exposure, then your risk of heart disease goes down 25%. The risk of cancer, overall cancer, goes down 15%. Traditionally, us doctors have been thinking that, okay, you can stay out of the sun, but just take vitamin D. Vitamin D is really just a biomarker that you have gotten enough sunshine. So all the research showed that if you had a better vitamin D levels, then you would survive COVID better and lots of other different diseases better. But when people were giving supplements of vitamin D, it didn't improve as much as expected. And the reason for that is that vitamin D is just a sign, a biomarker that this person had got more sunshine than another person. Because the sun exposure also will lead to a release of nitric oxide in the skin that is stored under the skin with the research of Richard Weller. So there will be a lot to gain from getting sun exposure even at this time of year.
But if we're completely sort of wrapped up as you and I would be in Norway or the UK, only effectively our heads are exposed. So are we going to get the same benefit?
Yeah, because the sun sends out electromagnetic energy in the form of photons. We can see some of them, so we will see half of the sunshine is within the visible spectrum, but half of the sunshine will be in the infrared spectrum. And that can go through clothes and will go deeper inside our body. The infrared will actually reach half of our cells. Of course, when we have clothes on, it's not as efficient, but still a lot more than not being outside. So there will be something to gain from that. And of course, there's a red light therapy also that is possible to do to compensate somewhat in this time and maybe go on a holiday to the Canary Islands. We can see that in heart rate variability. When I see curves from heart rate variability from people going from Norway at this time of the year down to the Canary Islands, there's a huge difference in heart rate variability.
And they're probably also more relaxed because they're on holiday as well.
Yes, but also just from the sunshine, sun exposure, it would be a difference.
So if I'm wearing a wearable to constantly monitor my HRV, might it give me an indication, for example, if I'm sickening for an illness?
Absolutely. You would see both an illness like COVID or getting the flu or things like that. You would be able to see how much surgery affect you. That could be a surprising long time. At least I'm surprised when I see the numbers from people going through surgery, how long time it will take for their body to be back at the same recovery state. But also diseases like cancer, there's several people that have written to me explaining that the long time dip in heart rate variability proved to be cancer after a while when they investigated. Also, if you have iron deficiency, B12 deficiency, vitamin D deficiency, it could be detectable in the heart rate variability.
It potentially is a bit of a red flag that something's going on.
Something's wrong. Something's wrong. Yeah.
And what about if you're recovering from illness? I'm just recovering from a throat infection, as listeners can probably hear. So I'm not doing any exercise at the moment. Could it help guide me about what will be the appropriate level of exercise and when I could start doing that again?
Absolutely. So you would be able to see, for example, if you do exactly the same exercise that you did before you got sick, you can see how much will it now strain you, the same exercise. I was running the New York Marathon just a month ago.
Oh, congratulations. What was your time?
Thank you. That was really slow. I'm not a fast runner, so I was 5.5 hours or so. I deliberately did not want to run faster than 5 hours because that would mean that I had to exercise too much. And with all the success of the book, I don't really have time anymore. I was just exercising for half an hour, running on a flat surface for half an hour, twice a week. And then I could see, the difference that a poor night's sleep, alcohol, different things would affect the recovery rate from that same half-hour exercise. And of course, after being sick, the same exercise will strain you so much more, and you will be able to see that strain in numbers.
But isn't there some evidence that people that run long-distance events actually damage their hearts in the long term?
Absolutely. The ones who strain themselves too much and maybe more importantly, don't allow themselves to recover afterwards, they get damages to their heart, micro tears in their hearts. So I think it was after Boston Marathon, they were checking troponin levels that will show heart damage. And they could see that half of the runners had some damage to their hearts. And of course, then if you don't allow maybe a week of rest, and you just maybe go just for a couple of days afterwards, you push yourself again, you're not allowing the body to recover. So really hard exercise, we're not made for that either.
So what made you run the marathon knowing there's potentially risk?
I didn't exercise much, half an hour, twice a week, in zone 2 training. And I was not running fast. I was in New York and I was wanting to take in the atmosphere and enjoy the run, rather than run 15 minutes faster. Of course, I was really tired at the last 3 kilometers, but other than that, it was just a fantastic experience. So I deliberately didn't want to push myself too hard. And after that race, I was not exercising for more than a week to allow my body fully to recover. The problem is, as in all medicine, there's an overdose and there's a right dose of everything. And what we have to look at is the physiology that we are developed under for like 3 million years. Because when we put these wearables on hunter-gatherers, we see that they're in moderate activity 2 or 3 hours a day, and the rest of the time they rest. They're not living like us, pushing ourselves, around the clock. And when we deviate too much from those circumstances, then we damage ourselves. And our system is not made for high-intensity exercise 12, 15 hours a week. It's not often that you're surprised by the longevity of former athletes. When you see the obituaries, they're not often into their 90s. So we're not made for that intensity. Our bodies will react with stress and inflammation because our bodies will interpret this hectic activity like it's a war going on. So it will differ the physiology if we are pushing ourselves so much every day over a long time.
So people listening to this who think, I think my heart rate variability is a bit low, there's nothing obviously wrong with my health. Let's talk through some of the steps that they might take that you discuss in your book. One of which is good sleep. How can we ensure that we get good quality sleep?
Yeah, the last hour or two before you go to bed, you should wind down. Dim the lights, do whatever calms you down, read a book, listen to a podcast, whatever is visible and measurable on your monitor that calms you down. It may be a surprise.
Well, I notice on my Fitbit, actually, if I read a book, it often thinks I'm asleep.
Yeah. And that could probably happen to other wearables as well, because the wearable can only see that you are very still and breathing very slowly, just as if you were asleep. We have to use our own intelligence in combination with the artificial intelligence. So the watch, from what it can detect on your hand that is calm over time with the slow breathing, but it will show you then that this is as restful for you that the watch thinks you're asleep. So that's a good sign. Maybe reading is a perfect thing for you in the evening. For a dyslexic, it would be probably terrible. A lot of people find out that they can see a certain type of programs on TV and rest, and not other kind of programs. It will be a clear difference. And also to make sure that you get 7 to 8 hours of restful sleep, that it's restorative sleep. And that is measured in the heart rate variability. Because you could sleep with alcohol and it would be non-restorative. It could be sleep after a late night meal. That would be non-restorative. So most people, when they start tracking their system, quit eating at least 3, maybe 4 hours before they go to bed, because they can see that they're sleeping better and more restorative sleep. We are not made to eat close to bedtime. The bedroom should be really dark, totally dark. You should not be able to see a hand in front of you. And it should be maybe 15 to 18 degrees centigrade for optimal conditions, which mimics the way in the night in Africa where we come from, where it would be cold at night. It's kind of a biological signal to the body. Now's the time to recover.
But our ancient ancestors in Northern Europe wouldn't have been sleeping in temperatures of 15 to 18 degrees at night, would they?
No, they wouldn't. But they came here 10,000 years ago.
Well, I must say, I always switch off my heating at night. So probably, well, I'm sure the temperature would drop below 15. So potentially I should keep my heating on overnight.
Yeah, and you could be able to see that, to experiment. What will be the difference measured in the heart rate? Avoid caffeine after 12 o'clock, 12 noon. Avoid late night meals. Avoid late night exercise. Avoid alcohol. The pulse cure starts with sleep. Then you have more energy to do good choices throughout the day. Because the problem comes with if you have a poor night's sleep, you will be stressed. You will want to make quick solutions, get some quick carbs and skip the exercise. You want to start the day on your front foot. With a good night's sleep, you're more ready to make better choices throughout the day, because our willpower is also coupled to heart rate variability. So the better heart rate variability, the more willpower you have available. For example, they have been doing research on alcoholics and found out that the alcoholics with the lowest heart rate variability is the ones who are most prone to fall for the temptation to have another drink and get back drinking again. So sleep is fundamental. That's the most important thing you can do.
I had a while back, a sleep expert was on the podcast, and he said a problem even greater than sleep he thought was sleep anxiety. So when people can't sleep, they get more anxious, more stress, and that actually makes the situation worse.
Yeah, poor sleep is usually too much stress during the day. So maybe they have to solve their stress problems. For example, if I eat chocolate after 4 o'clock, I think, I cannot sleep. I will be too stressed. My heart rate will be too high. If I have eaten something with chili in it, the same. I will have problems falling asleep and I will wake up at 2 o'clock because my heart rate is beating hard. There's also surprising sources for the anxiety. A lot of people find out that when they eat other kind of food that they may tolerate better, their anxiety level goes down. They're better able to sleep because your body is not in an inflamed situation with a heart rate maybe 10 or 15 beats more. And it's hard to sleep when you have this kind of overdrive with adrenaline and so on. So it may not be enough to calm yourself down mentally. You may have to make changes to get your overall state better. Maybe to go exercise. Maybe your fitness level is too bad. If you have a VO2 max of 30 or below, that may be the problem. You don't have good enough mitochondria. Your fitness level is too low. Your body is in overdrive, even with only daily activities.
Another thing you touch on is breathing through the nose. This is something I'm guilty of because I certainly don't do that. When I'm asleep, I think I breathe through the mouth, which isn't a good thing.
That's not a good thing. Yeah. And people will see that there will be a difference in heart rate variability when you tape your mouth. Our noses are made for breathing and our mouth is made for eating. The tape is not a big problem. I use it also a lot of the time. And I use it particularly if I get a cold. Because then I start breathing with my mouth. And then I wake up in the night, my throat is dry. And with the tape, it's perfectly fine. I will breathe through the nose.
Interesting. Well, perhaps I should try that. Now, another key element you talk about are breathing exercises. What are the sort of simple approaches that we can follow?
Yeah, keep it simple. And also just breathe slowly. So that's the most important thing, to be aware that you're stressed and then to calm yourself down by breathing slowly. So this again is kind of hacking our operative system that traditionally, if it's calm outside, we're breathing slowly. But we can also breathe slowly to give a signal to our body that it's calm outside. So we can trick our bodies. And when we breathe slowly, we calm ourselves down. So in the book, I recommend 4 seconds in and 6 seconds out, that your out breath is a bit longer than your in breath. That is also supposed to calm yourself down. But the most important is to breathe slowly. So if you don't like counting, just breathing slowly is the most important. And somewhere around 6 breaths a minute seem to be the best for most people.
So one could do this 4 seconds in, 6 seconds out, a number of times throughout the day.
Absolutely. And you can do it in meetings, in phone calls, so when you're talking, if I need to calm down.
I'm trying not to make you too stressed, Torkil.
Yeah. But that could depend on other things. I could have been eating something I'm not supposed to eat or so. Then I will breathe slowly. The good thing is that it's invisible, that even if you're in a meeting, before a presentation or during a presentation, when you breathe slowly, it's not visible to other people. So it's always available. You can always use it. It's the most effective way to calm yourself down. I write about it in the book because the nurses at the ER have been on the course learning to breathe. I couldn't stop laughing. Why would you learn to breathe? We're just breathing. But now I understand that it's probably the most important thing to do. You have kind of 2 ways to calm yourself down, and that is by cold exposure and breath work. That is the 2 most efficient ways to calm yourself down.
So how many times a day do you do that?
I do it now without thinking about it. And I can do it also while I'm doing things. So it's not only that you're sitting down to relax, but I can do it on the go.
So you might do it 10 or 15 sessions a day?
Oh, at least, yeah. I would probably do it more than that, 20, 30 times a day. If I'm in the shop getting annoyed by the person in front who can't find the credit card or whatever, okay, that's an opportunity to breathe slowly and calm myself down.
Now, you've just hinted at something that personally fills me with dread, and that's cold showers.
I just had one.
Okay, so what's the least painful way to get into cold showers?
Yeah, to accept that it is painful. It will be painful and all the time. So I still dread, in the shower, I have a timer that I can see. I'll do 2 minutes typically. I shower normally first and then turn it all the way to the coldest, which here in Norway now is maybe 9 degrees.
Because I was going to say, it's going to change, presumably, how long you have to do this for, depending on how cold your cold tap goes.
Yeah, so the colder, the shorter time. So if it was 15 degrees, summer maybe, then I may need to do 3 minutes instead. And the most important is that you can see it on your watch that it works. That is motivating to do these hard things.
So should I start, say, at, 30 seconds and gradually work my way up?
Yeah. And of course, the worst seconds are those 30 seconds until your skin also gets cold.
Yeah.
So the easiest ones are the last half minute. But it is hard. It is painful. The body has heat shock and cold shock proteins that will help you to build your immune system. So it's very useful.
So when we stand under a cold shower, what's the biological process? Why is that beneficial?
After the shower, trigger the parasympathetic system. So once you're in the shower, it will trigger the adrenaline part also, but it will also trigger a low heart rate and an improved heart rate variability. So it's kind of the same as fasting. Fasting is also important, and fasting will trigger adrenaline, but it will also make you calmer at the same time. The cold has somewhat of the same aspects of it. On the other hand, heat is a big stressor. That may also be a surprise, that being warm, hot, too hot inside and in your bedroom, that will also take energy from you.
So wouldn't it be a good reason, therefore, for me to sleep in a cold bedroom rather than one at 15 degrees?
Yeah, I think 15 is quite cold.
Well, you see, for me, it might go down to 10 in my bedroom, easily.
But it depends how hot is it under the blanket. Probably depends on how warm your whole body is.
I mean, I tend to have my heating quite low.
Yeah, that's very nice to experiment, because then you have kind of 8 hours and you have a certain temperature, and there would certainly be differences whether you have 10 degrees or 18 degrees inside, and you would be able to see that.
That's interesting. Now, another thing to calm us down, you suggest, is meditation.
Yeah, and meditation works for a lot of people. For a lot of people, it will be stressful. And maybe even if it's stressful, that may also only be a sign that you really need it. Meditation is a way to calm yourself down for some people. I prefer reading, but I do meditate also sometimes. I'm using a Muse 2 band that will also read my brainwaves and will have a neurobiofeedback mechanism. So if my brain is disturbed or stressed, then I will hear more noises from the kind of jungle sounds, for example. For me, that's a very interesting way to meditate.
And what sort of meditation do you try?
In that system, that is guided meditations, but it can also be just sounds from the jungle, sounds from a beach. And the more calm my mind is, the more harmonic sounds I will hear. And opposite, if I get disturbed, if I get stressed, I will hear more noise on the beach, I will hear more noise in the jungle, and so on. But that is this particular system that I use, because I'm not really good at meditating. I think the best way for me to calm down is to read a book. I try to read a book a week to stay informed about the things that I'm writing about.
That's interesting, because I find meditation quite difficult when I've tried, and I've always thought, I should probably try harder. So it's interesting to hear that. Now, exercise is something else you talk about, and obviously that will vary hugely depending on an individual's fitness. But what would be, for someone who's perhaps not done much exercise before, what would be a good sort of starting point for them?
Then you should start, ridiculously low, and you should know and find out your VO2 max, because your VO2 max will tell you a lot about how much you can push yourself. If your VO2 max is as low as 30 or below, then you should really start slow. Maybe start just by walking and see how this trip will affect you. Maybe you would start, walking a bit more up hills and pushing yourself a bit more. But overall, a lot of people who start exercising from a non-exercising level will push themselves too hard. They will underestimate the reaction of their bodies. The people with a low VO2 max, it takes really little effort until they get into the lactic acid zone and will be too much stress.
So just go for sort of half an hour walk or something?
Half an hour walk and start from there. Maybe start to run a little bit, a minute here and there, and see how their bodies react to it. I would recommend people to do the 150 minutes a week of moderate exercise. Maybe, 15, 20 minutes of a bit hard exercise as well. Getting your heart rate up, is also really important.
And I guess swimming for people who aren't very fit is a safe exercise.
Yeah, that would be good. And also you should do some muscle work, strength training. That is also important.
Because I see you say that we should all be doing strengthening exercises every day.
Yeah, I think it's useful to do squats. That would be the most important. To have sufficient muscles in our legs and thighs That is really important. I just recently heard a concept called the dead butt syndrome, and that I can see when I'm working as a doctor. I can see that people are sitting too much. They are losing the muscles in their legs to get big bellies and thin thighs. It's not good. So you should do some muscle work, and then I do that every day. I do sit-ups, squats, and push-ups every day. It only takes 2 minutes. So it doesn't have to take a long time. You just need to get it in as a routine.
But I suppose for somebody who's got, I don't know, a dodgy knee or some other joint problem, some of those might be harder for them to do.
Yeah, they should then do what they can do. The good thing is about these squats, particularly and push-ups, is that you use a lot of joints. That's important.
So what sort of improvements have you seen in your life following this approach? How do you think your health has changed?
Well, I'm still healthy. I have a better capacity. I feel better. I'm not tired as often as I used to be. I'm kind of operative all day. I just feel better, more energy.
And have you managed to persuade all your family to follow the same approach?
Yeah, even my children. My daughter can see that if she's too stressed, she'll get a migraine. And I can see from her migraines that you don't want that. It's painful, it's just throwing up. But once she managed to have acceptable stress levels, then she avoids that. A lot of the migraine people are the ones who are happiest about the pulse cure because they get rid of the migraine. There's even one who had an Instagram account with a chronic migraine, and now she doesn't have it anymore. There's one thing we haven't talked about, and that is the menstrual cycle. And that has so huge effect for women. So the week before menstruation is a visible dip in heart rate variability. And when you manage to mitigate that stress, you can minimize your PMS symptoms. And when it comes to all reproductive problems, they have a relationship to heart rate variability. So endometriosis, polycystic ovarian syndrome, infertility, tendency to spontaneous abortions, and the cancers, and PMS and PMDD, they all have a connection to heart rate variability. And most of the people who follow me on Instagram, I think probably 85% are women. And so many of them can tell that when they can manage their stress levels better, that will improve all of these aspects. And the reason for that is that when you are too much stress, you have more cortisol, and that will kind of backfire at the hypothalamus level. And also progesterone is a part of cortisol. It's a precursor. And if there's too much stress, then the body will prefer cortisol to progesterone. The body will prioritize survival before reproduction anytime. So it's actually kind of an inbuilt system that if you are too stressed, you're not supposed to get pregnant. It will, of course, not stop it, but it will reduce the chances of you getting pregnant, and it will disturb all the factors connected to reproductive health.
And what about for older women taking HRT? Do we know about the impact that HRT has on heart rate variability? Because you were mentioning that as we get older, our heart rate variability drops. So I just wondered if HRT elevates it again.
Yeah, it will elevate it. I get lots of reports that the bioidentical HRTs will be better for their heart rate variability. So a lot of them will try different brands, and they can see on their heart rate variability, which also will correspond to what they feel, it will be better in certain brands more than others. So absolutely, that can be measured in heart rate variability.
So as a GP yourself, when patients come in to see their local doctor, do you think the doctor should be prescribing wearables as a treatment?
Yeah, they should, at least if they come with stress-related diseases, problems with sleep. You can often see that they have a lifestyle that is causing them problems. And also the ones who are too much stressed, they're doing too much, stressing themselves too much, that it's a way of breaking down their speed. More people come to me and read the book that needs to break down their physiological speed. They're too active, doing too many things, recovering too little. But most of the patients at the doctor's office will be in the other end, straining too little, not getting out of the couch. And they're not contacting me that much, not so motivated. And it will be harder to reach them, I think, even with this tool. The most important for me is that people know that this is a tool they can use, and then they can decide to use it. My job is kind of to let them know that this is a possibility, that your heart rate will be revealing the state of your system and that you have agency over it and can be kind of a CEO of your own health. Because most patients would think that your health is out of your hands, like we learned in medical school, it's genetic or a matter of luck or not. But you have more agency over your health, and your heart will be a kind of a speedometer showing this, and it can help you. There's a big kind of revolution going on. This is just kind of exploding, I think. Artificial intelligence will be able to help more than the doctor, because the doctor is only available there for 10 minutes every third month. This is available at all times. And Cristiano Ronaldo, the soccer player, he said it quite well. He said, having a Whoop band that he uses is like having a doctor on your hands. This is a huge shift in two ways. It's a shift from the doctor and the healthcare system having the power of your health, and it's taking it literally into your own hands. Timeline is shifting from doing things after you get sick to being able to do something about it and avoid getting sick. So those are two quite big changes in the attitude towards how we deal with diseases.
Really thought-provoking. Well, Torkil, thank you so much for talking today. So much interesting information to discuss. Thank you.
Thank you so much for letting me talk.
Goodbye. Hope you enjoyed the latest episode of the podcast. I was so intrigued by what Torkil said that I've actually gone out and bought a Garmin watch. So I'll let you know how I get on. And if you start experimenting with wearable devices too, I'd love to hear about your experiences. As always, if you've enjoyed the podcast, please do leave a review on Spotify and Apple. It really helps. Many thanks for listening. Bye for now.